Hello, I'm Dr. Julia Moritis, and I'm here today to go over with you what a crown is, why you might need a crown, what different types of crowns there are, and any other basic questions about crowns, because most people don't know a lot about them. What is a crown? So a crown is a substrate that gets put around your tooth, really for structural reasons, to hold everything together, because for whatever reason your tooth needs some help structurally. The difference between a crown, cap, and veneer, really crown and cap are terms used interchangeably. Really in the dental office you'll just hear us say crown, but sometimes just generally people will say cap kind of for shorthand. However, for a veneer, it's typically more for aesthetics, just for appearances, and we would just take off a tiny little piece on the front of a front tooth, and it's just to make enough space to kind of cover up whatever's there that we want to cover up. Will you be able to see metal in your new crown? No, you will not be able to see metal in your new crown. They are made 100% with white materials, so there is none of that darkening that sometimes you can see along the gum line in some of the crowns from years past. That is not an issue anymore. It will be just 100% tooth colored white. So, if you get a crown, will you need a root canal as well? No, not necessarily. So sometimes that can be a little confusing because generally if you have had a root canal, we do recommend a crown on top. However, if you get a crown, you do not necessarily need a root canal. There's no set amount of time that we expect out of a crown. Really, it's as long as it still is holding everything together and there's no new decay and there's no issues with the tooth. You want to take care of a crown just like any other tooth. You're going to want to brush right along the gum line, right where the margin of the crown meets your gum tissue. Floss it like normal and just leave it as is. It's not like we have to replace it every 5-10 years or something like that. It's just as good as it is. So the different types of crowns that are offered now are zirconia. That would be, it's a really strong material. We mostly use those for back teeth. They are very aesthetic still. They're, all white and they look really great. For front teeth, we tend to use pressed porcelain or a different type of crown called Emax, which they are both very aesthetic as well. They're all white materials, but just with different levels of translucency, which makes them look a little bit more natural with the way the light hits them and how see-through they are and all that good stuff. Are there any restrictions after getting a new crown? Generally, no. You can eat on them like any other normal tooth. I don't want you having like ice or anything like that you shouldn't be having with a normal tooth, but in all fairness, that probably would break your natural tooth before it would break a new crown. Do crowns bleach? No. Crowns, as well as fillings actually, will stay the same color from when we initially placed them. So if you're interested in kind of generally lightening your teeth, then what we're going to want to do is lighten them beforehand and then match the crown to your new lighter shade. Because once that's placed on there, it's not going to get any lighter. What happens if you do not get a crown? It kind of depends on the situation of the tooth, honestly. There are some situations where you could choose to roll the dice if you did not want to do it at that point, but what we're always risking is that the tooth may fracture further. If you bite down on something the wrong way and the tooth is not structurally sound, then the tooth could fracture in a way that now it is non-restorable, which means it would need to be extracted. So beforehand, while it just needed a crown, now it needs to come out and you don't have any tooth. So generally, if we do recommend a crown, it's to hold it together, but I understand some people, for whatever reason, like to see what they can do.